And welcome to another Mark Bishop Show. Well, with the holiday season quickly approaching, some people may experience a case of the holiday blues. In a moment, we'll hear from a board-certified psychiatrist on the importance of recognizing if you or a loved one are just feeling down, or if it's actually more serious, depressive symptoms. In fact, according to recent Centers for Disease Control and Prevention data, approximately 1 in 5 U.S. adults reported having ever received a diagnosis of depression by a healthcare provider. And for some individuals, depression can substantially impact certain life activities. I'd like to welcome Dr. Craig Chepke, medical doctor and DFAPA. Welcome, doctor.
Thank you so much for having me today.
Clinical depression, also known as major depressive disorder, MDD, is one of the most common mental disorders in the United States. Correct me if I'm wrong, Doc.
No, it absolutely is. As you mentioned, 1 out of 5 people, the CDC believes, have ever received a diagnosis. And in terms of currently, in a given year, about 1 out of 10 may suffer from it. So this is something that touches everyone's lives.
Well, let's have a look at it. MDD symptoms, shall we, can include depressed mood, loss of interest or pleasure in like daily activities, change in sleep, appetite or weight, diminished concentration, and a feeling of worthlessness. I mean, I guess you're right. When you think about it, we've all at one stage or another, we get those feelings, don't we?
Well, yeah. I mean, one or two of those maybe. The big difference is having multiple of them. So 5 out of those 9 symptoms that you listed, if you have 5 of those for at least 2 weeks, most of the day, almost every day, that's what differentiates major depressive disorder from just holiday blues, winter blues, any time of year blues. It's the frequency, how many of the symptoms, and then how severe it is. It's not just feeling a little down in the dumps. I mean, we're talking about the bottom of the barrel. I mean, really feeling hopeless, worthless, helpless, like there's no future. And loss of interest is not just, getting tired of a hobby. I mean, and it's a lack of ability to feel pleasure, maybe in your relationships, could be with your spouse, could be with your children, could be even losing interest in day-to-day grooming and bathing and things of that nature. So it's just a difference in the level of severity and intensity of the symptoms that really differentiate it. Because major depressive disorder worldwide is actually the #1 source of disability in the world.
Wow. Well, I got to tell you, doctor, I felt all of those things getting over COVID and after the COVID and, long haul. I guess you're hearing that quite a bit, are you?
That is a big topic. A lot of people are discussing that for sure.
Well, the good news, there are available treatment options that can help those experiencing TRD. Would you like to touch on that for us?
Sure. So, yeah, treatment-resistant depression, I like to say that psychiatry can't name anything right, because you hear the words treatment-resistant depression, you think, oh my gosh, well, I guess there's nothing left. There's no treatments because I'm resistant to them. But that's not at all the case. There are treatments that are available for treatment-resistant depression. One that I've seen some positive results with some of my patients with treatment-resistant depression is called Spravato, Spravato. So Spravato is actually a nasal spray that's been approved by the FDA for treatment-resistant depression, and it's in conjunction with a traditional oral antidepressant. So it's added on top of the person's antidepressant. So like all medications, there's potential benefits and potential risks, and Spravato for some people may have certain side effects and may not be right for everyone. So it's important to discuss it with your healthcare provider.
So if someone's listening to this now and they think, well, hang on a minute, he touched on a couple of raw nerves there. What would be the exact signs and symptoms to look for? If you're going to tag it clinical depression, right? What should I be really looking for to understand before I go running off to my doctor?
Well, honestly, I would say if anyone has any questions, go and talk to your healthcare provider, whether it's a psychiatrist, a therapist, a primary care provider, whoever it is. I would rather someone not be sure and talk to the healthcare provider than to hold off and wait, because that's too often happens. And then the depression goes undiagnosed, and something that's not diagnosed obviously can't be treated. And it builds and builds to where it can cause more and more difficulty in the person's life and disability and dysfunction. So don't wait would actually be my advice. Reach out and ask, is this clinical depression is this major depressive disorder, and have that discussion with your healthcare provider, because they're not going to judge you. They genuinely want to help. It's not a moral failing. It's a brain disorder, just like diabetes is a pancreas disorder, or heart attack is a cardiovascular disorder. It's just a common condition that is treatable. Is one of my key messages. So
you're saying if someone thinks that they have TRD, they should really turn to their number one provider, which for most people is their MD, right?
Yeah, the primary care provider is usually the person's first point of contact, and primary care providers can treat some cases of major depressive disorder themselves. And if it's beyond what their capabilities are, they can facilitate referrals to a psychiatric specialist or therapist or other professionals of that nature. Another important resource I want to point out is if someone is urgently experiencing a mental health crisis, just like we've got 911 for general emergencies, there's a number that's come out in the past couple of years, 988 nationwide. We can call or text that, and it connects you to the suicide or crisis lifeline. So if someone is urgently having suicidal thoughts, crises, then immediately reach out to 988.
Well, if someone out there or someone that they know, because this is also important, isn't it? Usually other people can sometimes, see it in their loved ones before they do. They were struggling with depressive symptoms. The best thing they should do is what?
Once again, reach out to the healthcare provider. Even if you're not sure, don't wait. Seek an opinion early on. And to learn more about treatment-resistant depression, specifically, Spravato.com. Again, SPRAVATO.com. You can learn about treatment-resistant depression, learn about Spravato, and also hear stories from real patients who've been treated with Spravato for TRD about their experience with the medication. Bottom line, don't wait and suffer. Seek out a medical opinion.
So what are some things that your patients have found helpful in managing their depressive symptoms in addition to treatment?
Well, it's a great question, because medication alone is rarely the answer. So I've mentioned a couple times therapy, counseling. That's incredibly important. I'm married to a therapist, so definitely we like to incorporate that into our treatment plans for patients. But then also making sure that we're taking care of our sleep, especially with the daylight savings time just recently changing. That disrupts a lot of people's sleep. And I like to say sleep is the foundation of mental health. Without a good foundation, your whole house crumbles. And also nutrition and physical activity. Yeah,
sleep again. Up comes the old sleep. Did you say you were married to a therapist?
I am, yes.
Well, that'd be fun times, wouldn't it? Sitting in the lounge room, zapping each other out, compared to reading
it's great.
books.
I get to work with my wife, and also my mom is my secretary, so it's a true family business.
Oh, my God, fair enough, too, and keeping the bills down as well. So what are some available resources if someone is seeking help right now who may be listening? I know we keep on saying the medical doctor. It's not a case of trying to find a psychiatrist, because you can't unless you get the referral anyway, correct?
Well, I mean, it depends. People can self-refer to mental health professionals most of the time nowadays. Insurance doesn't always require it, depending on which plan. But like you said, the primary medical provider is usually the first point of contact, and if they can either treat you themselves or they can refer you, help to facilitate that referral.
Now, you touched on how do you spell it again? Spravato, was it? How do you pronounce that?
Spravato, SPRAVATO.
Okay, now a listener who heard that, can they just go online and look up that or on Google, or what's the best way?
Yeah, Spravato.com, and that would take them to the manufacturer's website for Spravato, and there's a ton of educational resources.
How, in closing, with the holiday season coming up, and the long weekend and travel and all this, but everything that's going on at the moment worldwide, you must be getting more reports of depressive outlooks from people right now. There's a lot of fear out there, isn't there?
Yeah, I mean, there's always always a lot going on in the world, unfortunately, and but yeah, definitely the holiday season does tend to be an uptick. Just like tax season is an accountant's busiest time of year, I like to say the holidays is a psychiatrist's busiest time of year.
Those stats from the CDC, 1 in 5 U.S. adults reporting receiving diagnosis of depression by a healthcare provider. Boy. Well, thank you so much, Doctor. It's been very interesting and good advice. We've had Dr. Craig Chepke, a medical doctor and DFAPA, advising us on if you're feeling down, you might be feeling down. It doesn't necessarily mean it's serious depression, but now you've got something to think about. Thanks again, Doc. Appreciate your time.
My pleasure. Thank you so much for having me.